So we spent 5 minutes trying to affect a very gentle amount of force through this structure to open up the posterior elements of the SI joint on both sides. And I don't know if we succeeded or not. So here goes. I'm going to take up the slack. I'm going to spring now. Are you aware of anything different?
Yeah, it's pushing back against you when you let go.
She said it's pushing back against me when I let go. Yeah, that's what I feel. Line your stomach.
I'm afraid to get up and walk.
That's okay. That's okay. Superior glide. Take up the slack to a stop point, and then I do a thrust. This feels like a different structure. I feel it recoil back into me. Midline of the sacrum, take up the slack. Okay? Sacrotuberous ligament is here. Your thoughts?
I can actually feel you on it versus, just feeling like you're squishing it at that.
Very good. Lie your back with your head here, please. We'll keep filming. Your thoughts?
I don't notice any difference from here where it was fine to here where it wasn't fine before. It feels exactly the same now.
Okay. Now when I load you, I see your feet move. And now when I traction you, I see your feet move. Force translates all the way down there. Now today it didn't quite feel like it did yesterday, and maybe from sitting in class all day or
Right.
something, it changed. But yesterday it
so
intimidated
loose.
me. What was my behavior when I tested it yesterday?
Yeah, I think we were kind of feeling like it was almost like a bobblehead.
Precisely.
Yeah.
I mean, it was absolutely frightening. It just felt like it could keep going.
Yeah.
And I was tired. I didn't want to treat you. I just, didn't want to do that. But let's have you get up and walk around. We won't film her walking because we have people out here. So just keep the film going. Keep it going, please. And we'll just let you give us any subjective report. So yeah, just walk down there and back. And if someday a neurological model emerges and shows that this has nothing to do with actual movement in or through the structure, I'm good with that. I'm fine. I don't care. I'm more interested in techniques that help this population. And we have two very divergent cases. One is too much movement. One is too little.
So, last night we were, if you remember, we were talking about how, I felt like I needed to open my chest all the time in order to keep,
Excuse me.
bless you.
When you're talking, you'll come over here so the audience doesn't get your picture, please.
So, last night we were talking during the initial intake, and I was telling Jerry that I always felt like I needed to keep my chest open because it just it didn't feel good to not have my shoulders really super open. And now, just walking down there and walking back after just this quick treatment, I feel like everything is just automatically back where it needs to be. I feel like this is a little more, the curve is just more natural in my spine, but it's translating more to me and what I'm feeling in the front. I feel like I'm really much more sturdy on my feet. Be interested to see what's happening with my knee.
Lay down, we'll test it. Keep filming. So the terminology that I use is the body template, and your pelvis was distinctly different from what I perceived the rest of your body as being, and so that's what brought me to treat it. So you feel like your body is more aligned with the metaphorical...
The alignment is significantly different,
So-
everything's different.
Does it feel like we brought you back to your old self? Is that a way
I don't
of
even
speaking?
remember my old self, but it feels like it's a way better place than where
better
I
place.
was just at. Yes.
Thank you. I don't know if it would affect this or not. This feels pretty solid.
It feels solid.
Okay. Anything else you could do to test it as we wrap up?
To test,
Any other
to
thoughts? Well, your
test
sit
it
up.
out?
You said you couldn't sit up. You couldn't do a sit
Oh,
up.
I couldn't do crunches. Yeah, I could try that. That I don't feel in my neck at all. Not at all.
You would have felt it within 3?
Oh yeah, like, you know, just the strain was just so fantastically great.
Do a few more, because you showed that to me. I don't see it at all. Very good. Okay. So that is different.
That's completely different.
Okay, put your legs out straight. And do you recall that I spoke about how tight your neck was when I was checking it? And, you know, with me being tired, I'm missing on some subtleties, so I can't really say that I know that to feel different.
Mm-hmm.
I just know that when you sat out, I could see your whole platysma kick in. You know, I could see the definition there,
Mm-hmm.
and I'm not seeing that right now.
Yeah. Well, one of the things that we did was, this is something that I do all the time just because of how tight everything's been, is to place my hands here on my chest and then look up, and just the, you know, the pooling, you know, of the fascia and the platysma and everything, just, you know, right up into the jaw. I could actually like make my teeth hurt, you know, trying to get it, you know, stretch it out. And right now, I'm only feeling it right here.
So in 5 minutes, we were able to make an interesting change with your body. And I would submit that your pelvis and your upper cervical presented as being hypermobile, lacking that strong recoil, that kickback, if you will, during a spring test. And it's a treatable property. It's a changeable property in some of the population, and I think this is a very good example thereof. So whatever it is,
I'm pretty excited about it. It's been pretty invasive throughout most of my life, for the last 4 years. So
meaning
thank you.
Meaning it's impacted.
It's impacted, yeah. It's impacted my life in a pretty significant way. You know, they used to call me Chainsaw Annie because I'd be cutting down trees, and I kind of gave that up, you know.
Yeah.
So.
Good. Well, we'll teach you things to maintain that if it can be maintained, and we'll follow up with you and see how you do.
Good.
Thank you.
Thank you.
Yep.